The largest one that we see, it doesn't even deal with hand and upper extremity injuries, but just from taking call is younger or smaller children having a foot or an extremity kind of go underneath usually a ride-on lawnmower. And dad or grandpa or grandma thinks they're doing the kid a favor by letting them drive the lawnmower a little bit. And when getting down, they either slip while the mower is still engaged, and had people lose lower extremities secondary to that. And so first and foremost, keep these younger, smaller children away from those powerful machines, keep them inside. Definitely make sure the mower is off and disengaged, should they even be on the mower with you before they get off. People look at it and it's kind of like Fisher-Price-esque, there's just these little blades that kind of go, back and forth kind of between one another. The problem is that it is wide enough for a finger, even an adult finger, to go in. And the problem is with it going back and forth so quickly, it does a very significant amount of local, both skin and deeper soft tissue trauma in a very localized place. So you kind of get what we call segmental injuries. So it'll get a level at the base of your finger and then at another level further out. That just makes it more difficult for us from a soft tissue repair, meaning we're repairing potentially the same tendon or the same nerve in different locations. And it also means a worse outcome for patients. Thicker pair of leather gloves or landscaping gloves are always helpful, only from the standpoint of we deal with a lot of splinters and infections, and people think they got it all out, and then they show up and their finger looks like a Jimmy Dean sausage and has stuff oozing out of it, and they realize they didn't get all of it. Definitely protect your hands. Try to clear debris away from these other machines that you may be using, wood chippers or splitting kind of devices. So those hydraulic things have they have a lot of pressure, and so every year the same thing happens. Someone takes a finger off, and those are very hard to get back on, just given the crush nature of the injury. People will get a lot of blisters. Just try to keep an eye on those. Also, they can become infected, and some people say, oh, I just wrap duct tape on it and some bacitracin and go about their business. And many times that may work, and we're not suggesting that, but just keep a close eye on them. Some of those things can progress, and then all of a sudden you have a bigger problem.